Loneliness is a significant problem in Germany. It's a silent epidemic that often goes unnoticed, yet it affects a large portion of the population. Studies show that it affects around 60% of the population. This staggering statistic reveals the depth of the issue. This means that millions of Germans feel alone and isolated. Loneliness doesn't discriminate. It can touch anyone regardless of their circumstances. It affects people of all ages, incomes, and backgrounds. From the elderly to young professionals, no one is immune. However, some groups are more vulnerable to loneliness than others. The elderly, for instance, often face the loss of loved ones and reduced social circles. Young adults and single individuals are particularly at risk. They may struggle with the pressures of modern life and the transient nature of relationships. They often face life changes and challenges that can lead to social isolation. Moving to a new city, starting a new job, or going through a breakup can all contribute. These changes can be difficult and stressful. The pressure to adapt can be overwhelming, leading to feelings of isolation. They can disrupt social connections and leave people feeling lost and disconnected. It's crucial to recognize and address this growing concern to foster a more connected and supportive society. Young adults often experience major life transitions. They may move away from home for school or work. They may start new jobs and careers. These transitions can be exciting, but they can also be lonely. Moving to a new city means leaving behind friends and family. It takes time to build new relationships. Starting a new job can also be isolating. It might take a while to get to know coworkers and feel comfortable in a new environment. There is a stigma associated with loneliness, especially for men. Men are often taught to be strong and self-reliant. They may feel ashamed or embarrassed to admit they are lonely. This can prevent them from seeking help or support. Many men worry that talking about their feelings will be seen as a sign of weakness. They may fear being judged or rejected by others. This stigma can have serious consequences for men's mental and physical health. Section 4. Loneliness, a public health crisis. Loneliness is not just a personal problem, it affects millions of people around the world, cutting across age, gender, and socioeconomic status. It is a public health crisis that demands our urgent attention. Studies show that loneliness is as harmful to our health as smoking or obesity. The impact of loneliness on our physical and mental well-being is profound and far-reaching. Lonely people are more likely to experience a range of health problems, from chronic illnesses to mental health disorders. Loneliness weakens the immune system, making it harder for the body to fight off illness. This vulnerability can lead to frequent infections and prolonged recovery times. It also increases the risk of heart disease, stroke, and dementia. The stress and anxiety associated with loneliness can have a direct impact on cardiovascular health. Loneliness can lead to depression, anxiety, and sleep problems. These mental health issues can create a vicious cycle, making it even harder for individuals to reach out and connect with others. These problems can make it even harder to cope with loneliness. Addressing loneliness requires a collective effort from communities, healthcare providers, and policymakers to create supportive environments and foster social connections. Section 5. Bridging the Gap. Understanding loneliness and health. Loneliness is a universal experience that can affect anyone, regardless of age, background, or social status. It is a complex and multifaceted issue that has significant implications for our overall health and well-being. More research is needed to understand the complex link between loneliness and health. Scientists are delving into the biological, psychological, and social factors that contribute to loneliness. By examining these factors, we can gain a deeper understanding of how loneliness impacts our physical and mental health. We need to know more about how loneliness affects the body and the brain. Studies have shown that loneliness can lead to increased stress levels, weakened immune systems, and even changes in brain function. Understanding these effects is crucial for developing effective interventions. This knowledge will help us develop more effective ways to prevent and treat loneliness. Healthcare professionals are working together to create comprehensive treatment plans that address the root causes of loneliness and provide support for those in need. We need to raise awareness of loneliness as a public health issue. Public health campaigns can educate people about the risks associated with loneliness and encourage them to seek help if they are struggling. We need to encourage people to talk openly about their experiences with loneliness. Sharing personal stories can help reduce the stigma associated with loneliness and create a sense of community and understanding. We also need to provide more support and resources for those who are struggling. Helplines, social workers, and community support services play a vital role in offering assistance and connecting individuals with the help they need. Addressing loneliness is crucial for improving the well-being of our communities. By fostering connections and creating supportive environments, we can help individuals feel more connected and less isolated. It is time to break the silence and tackle this growing epidemic. Together, we can make a difference by raising awareness, providing support, and promoting a culture of empathy and understanding. Let's work towards a future where no one has to face loneliness alone.